Yeah, well, hello everyone. I'm Dr. Nallely Ibarra and Laurel Ann. I just want to thank you for this opportunity and for giving me the chance to share some of the information that I hope a lot of you will find very helpful. And so I got into naturopathic medicine, surprisingly enough. I did not know about it until my first year of college, while I was, starting my undergraduate degree. My sister and I happened to meet up with our high school photography teacher, and just for lunch. And she was talking about her son's severe peanut allergy and how this naturopathic doctor was the one who discovered it. And she kind of just went on a little bit about what, treatment was for him and what testing was for him. And I was like, oh my gosh, this is like so up my alley that I didn't know that this medicine existed until, back then, which was now 2010. And so a little over 10 years now. And after that conversation, I went home and got on the internet and looked up what naturopathic medicine was. And I was like, this is exactly what I've been looking for. And that's truly how I got into it. And then very soon after, well, during that time, actually, I was getting hives, which I had never suffered from any, skin disorder or medical condition in my life until that time. And it had been about 2 years that I had been on antihistamines to help with the hives and the itching. And went through a lot of conventional testing, and nothing was really being discovered. And so I gave naturopathic medicine a shot. And even though, we got into what, the diagnosis of idiopathic juvenile urticaria, which stands for like, or which actually just means like, we don't know. Yeah, unknown causes. And, but, just going through the process of how my medical history was taken by the doctor, and the forms of testing and the different options I had for treatment were just incredible. I feel like I had options. I felt like someone actually took the time to take a look at my medical history and really figure things out for me. And the doctor mentioned, this is something that should go. It's juvenile, so it should go away in your early 20s, and it actually did. And so by that time, I was well invested into what naturopathic medicine was when things, when I got better, and I knew that this was something I wanted to pursue.
Great.
Yeah, absolutely. Well, I guess to answer that question, I better go into how they're different. I mean, how they're the same first,
Okay,
and then how
great.
they're different. Well, when anyone's thinking about applying to naturopathic medical school, you first have to get a bachelor's degree, just like you would with any conventional or allopathic Western medicine. And while getting that degree, you also must fulfill the prerequisite classes. A lot of those are your science classes, like organic chemistry, biology, anatomy. And then once you are about to graduate, that's kind of like when you start looking into the different schools. And so here in the States, well, I don't know about now, but back then when I was looking into getting to school, there were only about 5 to 6 naturopathic medicine schools between the US and Canada. So we're far more limited as to, where we get to go to school. Lucky for me, there was one in Arizona. I'm based in Arizona. For those of you that may be out of state and watching this. And so our first 2 years of naturopathic school look very much like those for allopathic school, where we're learning all the basic sciences, like pharmacology, anatomy, physiology, pathology. And then once you've completed those 2 years, then you take your first set of medical boards, very much like allopathic medicine as well. And I don't recall right now exactly, but I know between the second year and forward, we start learning all the other modalities, the naturopathic modalities, and now that's how we are a bit different. So we start learning herbal medicine, acupuncture, hydrotherapy, which is water temperature therapy, osteopathic manipulation, like much like the chiropractors do, or DO doctors, and minor surgery. We do go through a little bit of emergency medicine as well. And then once you've passed those set of boards, then you go on to doing your clinical rotations, which would be, the latter 2 years, and just get clinical experience under the supervision by another physician. And so, if you can imagine, being different in that arena, that's how a lot of the modalities of treatment open up for our patients. So now we can treat with, nutrition, with herbal medicine, with, and everyone's a little bit different. Once you get out of school, you choose what tools you want to use, whether that's acupuncture or hydrotherapy, or a mixture of all of them. Well, unfortunately, a lot of our patients don't find about our type of medicine, after years of not getting answers through their conventional doctor. Not everyone, first of all, knows about naturopathic medicine, which is one of the reasons why I'm so grateful for this course of yours, because now more people will have that awareness. But it's almost that word of mouth that gets out from people that have gone through that similar process of going to multiple doctors and specialties, and still not getting to the root of, their health issues. And I find that our health issues are typically not just one thing. I think it's a little bit of, everything. And then, if it takes one thing to be wrong, for many things to begin to go wrong later on. And so that's how most people will find us. And so I found it very helpful once when I started learning, in school, what values actually meant. And at Natural Med Doc, like you said, we do spend about an hour, sometimes a little bit more than that, depending on, what it is that we're going over. But it's pretty extensive blood work, and just to kind of help the people or the viewers understand or know what we go over. So it's pretty standard to get, regular blood work, as far as, what your white blood cells, your red blood cells are doing, metabolic blood work. So we're looking at your blood sugar, and then your kidney, liver function, as well as, we do a diabetes and cardiovascular risk assessment on everybody. We check for inflammatory markers as well. We do, what else? Testing vitamin D, a full thyroid, not a full thyroid panel, but an extended, thyroid panel. Depending on the situation, some patients will require more of an extended, very thorough thyroid panel, some won't. And then we also assess the sex hormones, vitamin D. That's pretty standard for most of our patients. And that just helps us really view our patients from different angles. Like I said earlier, we may have an issue with our thyroid, one organ, right? But then that can trickle down to affecting other organ systems. And what if, because they're so interrelated, that if your thyroid goes out of function or becomes dysfunctional, not dysfunctional to completely, but it's not working optimally, then it can begin to affect your sex hormones and your adrenal glands, which are, two little glands that sit on top of your kidneys. And so, before I get into all of, how it's all related, it just helps us understand, all this blood work helps us understand your individual makeup, and we assess it. We have, there's established normal ranges for some of these lab values, or for all lab values, really. And these are values based on what the general population has. And so that's how they kind of determine, what's normal based on the average population. And from there, we actually look into research very heavily and, figure out what lab values are more optimal, not just normal ranges, but optimal. And, based our treatment based on that. Something that we do at Natural Med Doc, and I can't speak for every naturopathic physician out there, but in Natural Med Doc, we sit with our patients and go line by line in detail with the blood work. And there's some drawing involved to help us understand, what your values mean. And yeah, most patients find a lot of value just from doing that, because then they're able to understand what's going inside their body. And more often than not, it helps us figure out why it is the way that, we're feeling the way that we're feeling. So yes, absolutely. I think, first of all, I want to say that I have nothing against allopathic medicine. I'm a firm believer that we need both, to get the best type of care, I think. Definitely think that a lot of the conditions, like chronic conditions, can better off be resolved, or at least, help by naturopathic medicine. And those conditions would be like metabolic issues, like, such as diabetes. A lot of the endocrinology stuff, well, diabetes being included, but thyroid conditions, sex hormone imbalance, a lot of for females, the menstrual cycle issues or problems. A lot of the inflammatory conditions tend to really benefit as well from naturopathic medicine, such as, rheumatoid arthritis, ankylosing spondylitis, lupus. Those are all conditions that are, worsened by inflammation. And so finding the areas that are causing that inflammation is very helpful, to, allow our patients to feel better, to be pain free, or at least, um, get to a point where it's well managed. Um, but same goes for maybe conditions that, are limitations, right? So I definitely would not want to be the one responsible to treat someone who, say, just got shot and needs to go to the emergency room, or someone needing surgery. Well, I'd say, like, not minor surgery, such as, a little skin tag removal that I can do, or a toenail removal, like I'm trying to do that as well. But definitely someone needing an organ transplant, that type of thing, like, do not come to me. I want you to get the best care at the hospital nearest you.
Right. Yeah.
But a
And I
lot of
wanted to
the
talk to you.
actually,
Yeah, go ahead.
acute, I think those are not all acutes, but some of the acutes, like needing medical surgery, or yeah, something like that. Go
Right.
to the hospital. So for you particularly, we did the elimination diet protocol. And so before I go into, what that is, there's this very famous quote by Hippocrates that says, "Let food be thy medicine." And so to me, that, even though it's almost like a cliche in our field to mention, it's so true. A lot of our, you know, like you mentioned, a lot of our health issues are rooted in the gut. Our gut, basically, if it's not well taken care of, and it's out of whack or not balanced out, it can really wreak havoc in our health. That can begin to affect our mental health, whether that affects our, our state of mind, such as, anxiety, giving us anxiety or depression, or for some people, brain fog, can't think very clearly, are forgetting things really easily. And not just that, it can also begin to affect your really, yeah, it begins affecting everything. It's hard to think of one just one thing, but like even your sex hormones. So for females, a lot of their issues as far as menstrual cycle irregularity could be coming from the gut, could be coming from the thyroid. So there's a lot of things that get influenced by our nutrition and our gut health. And so with you, we did the elimination diet protocol, in which this it's not, and I don't blame you for calling it a cleanse, because essentially you are ridding yourself of certain food groups, but it's not a cleanse. Essentially, you are getting rid of certain food groups. The most common ones would be the processed foods, the sugars, the dairy, because dairy can be, pretty pro-inflammatory for most people. And so those food groups are avoided for, about 3 weeks. And then after those 3 weeks, basically this is reducing the inflammation that a lot of, or from exposure. You're not exposing yourself to these types of foods that could be triggering a lot of your symptoms. And first of all, what are the symptoms that most people, where I would consider an elimination diet would be, someone that has joint pain or joint swelling, the brain fog, the headaches, all the abdominal issues like distension or bloating, diarrhea or constipation. So there's a wide amount of symptoms that would lead me to think that we got to work in the gut. And so once, and every case is a little bit different. This is what's, beautiful about naturopathic medicine, that not one case is the same. And so for you, I thought doing an elimination diet would be important, because then, we're taking those 3 weeks to limit completely our exposure for foods that are known to be pretty pro-inflammatory. And then we met 2 weeks, we met a week at the end of the third week, right? And we started a gut healing protocol. The gut healing protocol, essentially, I like to use a product that has a bunch of demulcent herbs. And so demulcent herbs are almost like a sealant that will coat the lining of your digestive tract, starting from your esophagus down to your stomach, to your small intestine, your large intestine, so that any of the damage that could have been caused by exposure to this inflammatory foods, then you begin to heal it. And so after we begin that, we continue food avoidance for another 3 weeks. And then at the end of the, 3 weeks, we meet again and we walk you through what food reintroduction looks like. Because, what may be causing you inflammation may not be causing the inflammation, but what may be causing the inflammation, whether that's something like, even like a health food, like kale, that you would think like, why would anyone want to avoid it? If it's causing you inflammation, then you want to avoid it.
Of course, yeah.
Right. And so if we go into that reintroduction phase, and I think that's probably one of the hardest ones, because we're not introducing food right away, like complete, all the food items. And so we actually began by introducing one food item at a time. And that, I always use the example of pizza. We can't introduce pizza right away, because that already has the dairy in it, has the flour and the sugar, from the bread. And so then we won't know what's causing your symptoms. And so, if you want to say introduce eggs, then just let's start with that. We'll do that for 3 days. And if you have any symptoms within those 3 days, such as, you feel your joints swollen or you get a migraine, and the reason why we say 3 days is because you may have something today, but you won't experience that symptom till 2 or 3 days later, right? And
Right.
so by doing that reintroduction very slowly, we're able to pinpoint what food items are causing your symptoms. And then from there, we probably will restrict for a little bit longer, and maybe or may not be able to reintroduce later on. Well, one of the things I tell most of my patients is that healing is not an upward curve. It actually, it can go up and down, up and down. But something wonderful that you just mentioned was that you were able to take a step back and kind of look at your entire life and all the different aspects that maybe needed some change, whether that was something emotional or just habits or way of thinking, because it all does come together. And like you said, there's no one miracle pill or one miracle protocol that's going to get rid of everything. But also we got to keep in mind, how long had did it take to get where you're at, right? So it takes time. Naturopathic medicine or lifestyle medicine can actually be quite challenging because it requires a lot of effort and dedication. And some of us were just not, raised that way to really change our diet and our lifestyle. And so it can be quite challenging. And it may take time.
Yeah, for
That's
sure.
another thing. It takes time. That's the beauty of it too, is that, for a patient that, has to put in all that effort into eliminating certain foods, but then reintroducing it, then you begin to for yourself experience the impact that food can have in your body. And so then I think it makes it a little bit more clear as to why you're following certain protocols, because now it helps you discover what could be something that's triggering your body. And so it's easier to avoid when you know the impact that it has on your health and when you don't. Yeah, and so you're absolutely right. Most insurances don't cover for naturopathic medicine, and because of that too, even I think there's one insurance company that does pay for preventative medicine here and there, but most of our locations or most of our practices are not. They're all purely cash based, just because of how difficult it is to go through doing using that insurance process. And so natural med doc, we don't like to assume that no one's struggling financially, right? Because that's just not realistic. And so our goal is to help as many people as we can. And for that, we do offer payment plans for patients that want to, give us a shot. Like I mentioned earlier, there are times where just going over that first initial blood work is very eye-opening, and it helps patients take hold of their health. And that's maybe all they needed. For most patients, like, they do need to, or at least would benefit from, follow-up care, which again, that's when more of our treatment protocols come in, and where we can use those financial aids. Like our clinic, and I don't know about every other clinic, but we do have almost like I forget what the term for it is, but it's some sort of like care plan that you get a loan, a small loan that you can then pay off in a year at the smaller payment plan. And then for patients that don't have insurance, for health insurance, then we have there's a lab in Florida where we can send your personal blood work, and then they'll run the labs for a much more conservative or cost effective price.
That's
So
great.
there's different options. Yeah, and that's actually, I would say that's pretty much true. I mean, depending on what your health condition is, but yeah, if that problem goes unresolved, then it has the potential to become greater in the future. And going to the hospital is not anything, that's inexpensive.
Right.
So, and then having to be on a prescription lifelong also can, if it can be prevented, then better, because then you're saving money, later on than when you depend on medications. Yeah, even
Are there
in your mental health, and how you view things, I think, like, because I feel like a lot, I mean, it happened with me when, like, I've gone through my own health issues, right? And when when things didn't look right for me, and then that started affecting my mental clarity too, or not my mental clarity, but more so my emotional state. I feel like I was more anxious, and that could just go down through like a rabbit hole and make things seem a lot worse. But once you get a little ray of light, and that just little light there can truly just open up a path for healing. And then later on you realize, oh my gosh, it was so worth it, and now I feel so much better. Just I feel like I can do this. I'm still not where I want to be, but I can do this. We take our success stories and compare them to potentially some of those patients that maybe didn't have as the results that they were looking for. But when we look at all of those together, we saw that patients that and you know this because you're one of our patients. We have packages, right? For because we'll meet for the second time and review your blood work, and then from thereafter we talk about packages, and what those packages include are a number of consults that we would have in a given year to meet and make sure we're achieving those health goals and review more blood work and whatnot. And so our patients that had invested because there was something to hold them onto, I think, had more positive results than those that, like you said, didn't have anything to hold them onto. Because then, like you mentioned, if it was a dietary protocol, which can't, it's not always easy, then it may just be something as simple as, well, let me just cheat right now, and then that little cheating, it can actually make a huge impact on your results. Well, I mean, I absolutely recommend it. Just because, like we've been talking, it gives you different views from what you may be used to, might have heard of before. There are some patients that unfortunately were told like there's nothing left, to do, and that could be very, very discouraging. And once we start addressing things from different angles. It may take some time, but patients definitely begin to see results. And so, if you've been one that been struggling for years and not feeling well, and you want to get back to who you were in the past, as far as activity level, or um, just how you're able to live your daily life, I'd say finding a trusted naturopathic physician who's board certified, because there's naturopaths that are not board certified, and I highly recommend to go to someone who is board certified, because this means that they've gone through the training to really help patients. They've gone through the boards. And I don't think I mentioned this, but after your 4 years of medical school, we do take our clinical boards as well. And they're pretty rigorous. And so
Yeah.
you want to make sure that if you are getting help by a naturopathic or naturopath, make sure that it's a naturopathic physician who is board certified and who has credentials. And yeah, don't give up hope. I think there's a lot of options that maybe you may not know about, but they're there. And so don't just settle for a pill, or don't just settle for an answer of there's nothing else to be done.
That's a great note to end on. Thank you so much, Dr. Ibarra.
Oh, you're so welcome. And again, thank you for the opportunity. And I hope that this is very helpful for many of you out there. And check out our website. Check out online. You can find a ton of resources on what naturopathic medicine is. And reach out if you have any questions, I can be found at naturalmeddoc.com.